and welcome to another episode of DIOTALK. I'm DIOTALK. My guest of the evening is a forensic nurse expert, all the way from New York. Ladies and gentlemen, give a warm welcome to Rachel Countryman. Welcome to the show. How are you?
I am good. Having a great weather here in New York, so that's always nice at this time of year.
Well, that's amazing. I know this time it's when things start getting cold and leaves and wind. So we're grateful right now.
And snow.
So tell me, you started your own business. You started your own consulting firm business. Um, and I kind of want to leave the floor to you to discuss and go as free as you want
Okay.
to because where your experience is very it's very specific, right? It's not very common, and you're being very courageous in sharing your story. So the floor is yours.
So I became a nurse about 22 years ago. After falling in love with the movie Steel Magnolias, I had thought I wanted to be a labor and delivery nurse and work in the nursery. That didn't really happen for me. I became an OR nurse and loved it. And then, as I became a mother, I have two children, so a boy and a girl. And my nursing kind of evolved where I kind of worked around my husband's schedule. He was a police officer, and I couldn't really be on call very much. So I joined, or I got hired at the local military base here where I live. And I started out there in the urgent care clinic, and then, kind of did some different things. I was a head nurse of pediatrics. I was a nurse case manager. I worked in pain management. Um, and then I became a SANE. Like it kind of evolved where a position needed to be filled. And the current director at the time wasn't really comfortable as the director. So I don't know if you know much about the military, but sometimes they get voluntold to do things.
Okay.
And yeah, so he kind of got put in this position and, really trusted me in my nurse case management role. And he thought that I would be great at running this program. So I went to San Antonio. That's where we do all our training for sexual assault. And I got my training and then, began doing exams on our soldiers and any of their dependents. Anyone that we could see at the military treatment facility is who we basically saw. And as I gained experience and, really fulfilling that program manager role, which was administrative and clinical, I really got to be close with the judicial system. So obviously doing these types of exams, there can be a legal component to it. So
Okay.
yeah, so in the case of military, we had court martials and I would actually testify as a fact witness originally. And, basically as a fact witness, I would just tell the panel or the jury or the judge what it is that I saw or heard or documented in my exam.
Wow. Now you were employed by the military, but you weren't like a soldier, right?
Correct. I was a
Okay.
civilian. Yep.
Now the way the laws and guidelines under the military is totally different than regular civilization, or is it that it's falls under or just
Yeah. So, I mean, the military has their own rules. And if you were asked to ask me about
hmm
the procedures and the policies for sexual assault victims that the military has, it's like top notch. So they ensure they have the exams that they need, advocacy. They have special lawyers that are for them that they don't go to trial. They're just
Okay.
their own specific lawyer. And we have great follow-up, which is something that's really missing in a lot of communities, is that follow-up
Make sure
factor.
everything's okay. Yeah.
Yeah, follow-up
Yeah.
pictures or follow-up, yeah, just to make sure that medically, emotionally, everyone is okay. Yeah.
Yeah. So you started your career doing this. I can imagine at first it was kind of it was overwhelming, right? From training to learning all this information and finding your place in this ethical realm on how to practice, evaluate, jot down notes and all this, right?
Yeah. So I mean, I'm still learning, this is a field and like a lot of nursing, like we're always learning and improving. Thankfully, the military is big.
Yes.
So, even though I was the only one here at Fort Drum locally where I was at, I could reach out to others who were program managers who had much more experience than me. So I'm not afraid to ask for help if I don't know an answer or, I'm trying to find out, best practices, other places. I'm never afraid to reach out and ask for help. So in that case, did have a lot of people there, that I could phone a friend,
Yes, yes.
or to speak. Yeah,
Colleagues, people to trust, people who could guide you, which support essentially what you need when you're in that position, right?
absolutely. Because you can't, grow and get better if you're not being mentored or, um, you need someone to kind of evaluate what you're doing. And it's not to say that what you're doing is right or wrong, but ultimately you want this patient who comes in and is asking for help, whatever outcome it is that they want, you
Hmm.
want to be able to help them in that journey, so to speak.
Got it. Now, was it when your first in your first encounter, not encounter, but in your first couple of years, was it difficult to you as a woman to because essentially you evaluated somebody who's like you, right? Same sex, female, emotions, like what was it difficult for you to readjust? Was it a life changing moment, a moments?
It, I mean, offering the service to patients in need of this
Mm,
is definitely life altering. For me, I didn't really have a hard time with it. I still don't. I'm very good at kind of keeping my own mindset at a good place and, not allowing someone's trauma to kind of invade me. Um, I just kind of think about it as, what is the good that I'm doing and, how I'm helping this person because it's really about giving them back the control that they lost,
mm,
during this traumatic event. So any way that I can kind of help them, just give them, their options and let them decide. Um, and that's kind of really rewarding for me.
yeah. Yeah. Now you did the practice in Sacramento. You were at that moment you were living still in New York, correct?
Yeah, so San Antonio. Yep.
Okay.
Yep. So I flew to San Antonio for 2 weeks and it, again, really great program. We had live models. So I left the program and have already worked on a real person.
Okay.
So that helped. And then, I took out endless hours of call. Like, um, this is one thing I think that happens is that, people want to learn and they want to grow in this field, but you really have to be on call. You have to go in, you have to do exams, you have to practice. And, that's how you improve and get better.
I agree. I agree. Self-education sometimes, researching, practice, like how would you get better if you're not doing those things? Now
Right.
you after 22 years, what made you want to start your own consulting? Like what are some things that you can offer?
Yeah. So, I loved being in the courtroom. And, when I became a program manager, it was more than just, being an administrator of this program of sexual assault. It was getting out and creating a multidisciplinary team. So, meeting with law enforcement, meeting with the legal team, meeting with advocacy, all of that, like, because we all come together as a team. It's not
Mhm.
just one entity, that does it. Because if you don't come together as a team, then everybody thinks their role is more important than the other. And then
Mm.
you're like,
Yeah.
it's just not good for the patient. So, I had opportunities, like I had mentioned, to do a few court martials, and I loved it. And the feedback I got um, from JAG was that I was great at being an expert witness. Like, I remember the first comment was like, "You were better than the person we paid all that money for." And, I was kind of like, really? I just love that aspect of it. And so then I decided, okay, how can I do this? How can I, you know, and that's when I discovered legal nurse consulting. And so I really thought I was going to do 20 years and get vested in the military before I kind of went off and did my own business. But I kind of progressed a little bit earlier than that, and I actually just left this June at
Oh, wow.
18 years. I almost
Wow.
made it to 20. Yeah. But yeah, it was just really being in those court martials, working as a team. And I loved it. So that's when I pursued, kind of doing this on my own.
Wow. What are some things you can offer? Like, how is it? Do they contact you? Do they call you to hear your experience, your services? What is it?
Yeah, so I help attorneys decipher medical, any,
Okay.
so my specialties are sexual assault, intimate partner violence, and strangulation. So those
Oh,
are
wow.
my main specialties that I can do expert work in and testify. But, to start, if attorneys have cases where they have medical records and they have a sexual assault, even if, sometimes I can even assist if there is no forensic exam that's completed, because sometimes they'll go to the ER and there's just things that a nurse knows
Hmm.
from working within the field. They
Yes.
can help clarify for those attorneys. So, reviewing medical records, letting them know what's missing, because sometimes they don't know that there should be other records that are missing. Looking at photographs if they were taken, and kind of deciphering what those injuries are.
Wow. So you
Yeah,
you serve as a guidance on what to look for, describe what's usually found, to give them basically an image on what occur on a scene or with a person, which
yeah,
is wonderful.
yeah. And so as that consultant, I can kind of guide them. I work for both sides, prosecution and defense. The prosecution is more interpreting and kind of guiding the jury, because part of that is, if I'm asked to testify, is, explaining these terms to the jury so that they can understand exactly, what we're talking about. We're not pulling in big words, alternate light
Yeah.
sources, and toluidine blue, like we're bringing those terms down so that they can understand what they are, how we use them, and when we have findings from that stuff, then they can understand how we got those findings, which is then giving them the information they need to ultimately make a decision in the end. Sometimes I will write written reports if an attorney is wants me to write a report. I've written reports that have helped a client get a plea deal, or I've even had reports help clients get the trial is a mistrial, or not, it doesn't go to trial. You know what I mean? It's just
Hmm.
like thrown out of court. I of course testify, like I have mentioned, in an expert role, and I can do that as a blind witness sometimes. And what that means is I don't actually know the details of the case. I just come in and I speak on an expert level, mostly like strangulation, and that would just be educating the jury, educating the judge, so that they understand, the mechanisms of injury that happen
Yeah.
in strangulation, and all those things. So yeah, it's just like this another piece to the legal team.
Hmm. Yes, it's based. They call you for your personal expertise, that to be informative, to educate basically everyone in the courtroom, to help them understand what occurs, what happens. Very important, crucial, detailed information.
Yes, yes, or what's not there.
Yes.
Sometimes we really look at like chain of custody, which is really important in these types of cases. And, making sure there was no break in chain of custody, because that could mean evidence coming in or evidence that can't be brought in, during
Mm,
a trial. So, yeah, just having those inside eyes, knowing what it's like to be there, do the exam, and then know what those standard protocols are.
wow. Do you have to follow a great amount of protocols in order for you to basically give information out there? Like, do you have to, let's say, oh God, I had a question, I just forgot. Protect the person's identity, or something like that.
So you mean like HIPAA?
Yeah.
So HIPAA is always,
Hmm.
first and foremost. And, I think things can be even more protected when we're talking about pediatrics. So, yeah, so there's lots of consents that have to happen during these exams. And, just when someone comes to the emergency room, if that's where they report, they've got to have consent for treatment, right? You've probably been to the ER before,
Hmm.
and you have to sign and consent to bill your insurance and all those consents. But there's actual consents that are very particular in the sexual assault exam itself. And, those would be, can I do a medical exam on you? If it's a female, can we perform a speculum exam? Can we take photographs?
Hmm.
And then, big consents are, how do you want me to release this evidence? So if we're collecting a kit, a lot of places, I don't know off the top of my head, most places allow patients to have a choice. Some are mandated reports where they have to call the police.
Yes.
In some cases, we can hold that evidence. We don't have to release it to law enforcement. And sometimes they need time to decide whether they really want to go through and pursue criminal charges. And then they can then release that kit. The kit's been collected, but all of those are consents that the patient needs to, we go through with the patient. And at any time, they can withdraw those consents. So if they say, yeah, you can take photographs, and then during the middle of the exam, which is a lengthy exam, they say, no, I really don't want you to take any more photographs, then we honor that choice of theirs.
It's intense but needed, right?
Yeah, I mean, it's kind of strange, and I don't, when I use the word strange, because I think society thinks of rape as, I always say Jack the Ripper, right?
Yeah.
Jump into the bushes, that it's always violent and there's lots of injuries. And I would say that the vast majority are not like that. They're usually done by someone that they know and trust. And that's it's really hard on a person if
Yeah.
that situation as well. It's more emotional, I think. Not that there's not any physical pain or anything in some of these cases, but um, it's just not, I think, what society thinks of when they hear the word
Yeah.
rape,
Yeah.
sexual assault.
Yeah. Did you in your training, did you have to take some psychological tests or some studies so it can help you better your profession, better your bed manners, better to not deal but assist the victims?
So, I mean, nothing specifically. In nursing school, we probably have we have to take psychology or that, not, and that's not even particular to nursing.
Hmm.
Now, in a lot of times, because of what we're dealing with, I mean, I've had some training through like our behavioral health specialists that we had in the military on, neurobiology of the brain, and it's just a better understanding of how the brain works, especially when trauma is involved, and how things don't act like normal,
Yeah.
and then how patients respond after, because there's really no normal reaction. I mean, I think typically people expect that somebody who's been sexually assaulted is just crying incessantly, and sometimes it's not that. Sometimes they're joking to get through this exam.
Yeah, they get or like in shock.
Yeah, I mean, and I have definitely seen at both ends of the spectrum. Most of the time, patients are very cooperative and they're answering your questions. Um, But I have had some very withdrawn patients that can hardly speak. And, you can kind of tell that they're almost reliving those events as you're asking them to, kind of tell you. And part of the exam is we do need to kind of know what happened because it helps us guide on our exam. Like, what are we looking for? You don't always, biologicals that might be on the body, you might not be able to see them with the naked eye. So,
Yeah.
yeah.
Wow. Incredible. How does and if you don't want to answer this, it's okay. But how does one become a specialist on you said you mentioned you're a specialist on strangulation, correct? How does one become a specialized, especially in that nature, in that situation?
Also training. So, I mentioned I did get my training, right, to become a sexual assault nurse. And then, furthermore, I became certified. So if you've just gone and you've done a didactic training that's usually 40 hours and that's all you do, then you're considered trained, right? So
Yeah.
you've had specialty training and you're trained. So I actually went further through the International Association of Forensic Nurses, and I sat and took a national board exam. So that then gives me my certification. On the strangulation, it's just taking, more advanced training, understanding the anatomy, understanding, what to look for signs and symptoms, and that it's having a competency on doing those types of exams. So strangulation really needs to come like a lot farther in the world today.
Yeah.
We need to be doing strangulation exams only. If somebody is strangled, it could be lethal. They could die. They could die today. They could die 6 months from now from a strangulation. So we really need to, push number one to have, funding to help pay for those exams, like someone who reports for sexual assault. We have
Hmm.
those types of grants that pay for that. But we need the community to understand how, scary and lethal strangulation is. Even if you feel fine after, inside you could have damage. But to answer your question, it's mostly training and then clinical experience.
And also, I guess the sense of curiosity and how would it look like? How does it work? How to learn how to identify something like that. Just look at, oh, this is what it is, right?
Yeah, and having that mentorship surrounding you, where if you have a question, you phone a friend and you learn. But always just taking more and more training, just to increase what you know,
Yeah.
and things are changing all the time. So just keeping all of that education up to date.
No. Yes, I agree. Now you mentioned your husband was a cop, right? Was
Yeah.
there any conversation when you first told him what you were going to do?
You mean as a sexual assault nurse?
Yeah.
Not really, because he knows I'm a little bit of a high achiever. So you know, um, my husband's always supported me, and no matter what I've done. And we would have some conversations, because he, as a trooper,
Oh wow. Yeah.
he would
Yeah.
report to the scene, and somebody is saying, I've been sexually assaulted, or, I've been strangled. And so I'm on this medical side of it going, you
Yeah.
believe that person, what they're saying. And, I see things obviously through
Hmm.
the medical vision. And what he has made me understand is that not everybody is looking through the same
Yeah.
set of glasses that I am. And so, being more open-minded to understand, like, what is law enforcement? How are they looking at it? And what are their thoughts? And the same thing with the legal team. Like, how are they looking? They're not looking through the same glasses I am. So, just being open-minded to hear what they have to say and then, just sharing what's
Hmm.
important.
Hmm.
Yeah.
Yeah, the different use of information. A cop of police is looking at it, putting the puzzle together, and and your experience, you're dissecting what has occurred. What can we prove? Somebody, a lawyer is it's using the information to create a case and find somebody either innocent or guilty, right?
Right, right.
But
Yeah.
I can imagine the support between you and him are amazing because imagine having a hard day and an ugly situation and that he has to respond to it and you actually have to dissect it, right? Like that has to be amazing. Knowing somebody is going the same thing you're going through and you don't really need to talk about it and but you find comfort in that support.
Yeah, yeah, absolutely. I mean, my husband just retired actually
Oh,
at the
nice.
same time I quit. So, he made it through, thankfully, because law enforcement, boy, it's a scary occupation right now.
Yeah,
Um, but yeah, always, we don't always see eye to eye. I'll tell you that.
I can imagine. Yeah.
Yeah, but definitely supportive of each other, for sure.
I mean, but you guys could become a team. He could become a PI, private detective. You guys help one another solve these cases, their own family business, you know?
Right now, he likes being my chauffeur.
Nice. Hey, you don't have to drive.
Yeah.
Um, is there and please if you don't want to share, it's okay. My sense just of curiosity, like, is there any scenario of things you have witnessed that has always stood out to you in your trajectory of 22 years? Has it been like you say a unsolved case or a doubt, like because at the end of the day, like you're doing this, but then your sense of curiosity, a detective side within you has to like emerge because you're in a position where a person is truth or false, right?
Mhm.
Everything has to be determined.
Yeah. So I kind of steer clear of that. And,
Got it.
as you mentioned that, like I've had many opportunities where law enforcement at the end of my exam, it says, well, what do you think? Did it
Mm,
happen?
mm.
And at that point, I just say, that's not my job to determine, right? Not my job. It's not.
Good answer. Good answer.
Yeah, so when I'm there, I'm basically, I'm there to support that patient as I'm taking care of them. But I'm there to document what I see. I'm there to photograph what I see. I'm there to write down what is stated. Um, I'm non-biased in that.
Mm,
So as this patient is there seeking medical care, yes, I am their medical advocate because they're there seeking care. But I'm not their advocate in whether what they're saying happened or didn't happen. Do you know what I'm saying? So
yes, yes.
at the end, I'm not making a determination that yes, this person was sexually assaulted or they're what or they won't weren't. There are very small like details, and it's mostly with children where we can actually say, okay, like a sexual assault occur. And a lot of times that would be like a pregnancy. If a pregnancy
Okay.
happened in a pediatric, young pediatric patient, or sometimes if we do find
Hmm.
sexually transmitted infections, those are more where we can say, yes, some
Yeah.
type of assault happened. But
Yeah.
in adults, It's really, it's more like that medical forensic exam is just one piece of the whole puzzle that needs to be looked at.
Got it. So see, this is why you got to hire her because her, she's very adequate. She has a lot of adequate, right? And where you're just writing down very straightforward, nothing more. Of course, that if you find something, you say what you find, but that's not an opinion. That's just factual information based on the evaluation you uh just finished giving, right?
Yeah, it's just really fact-based. What do I see? What do I hear? What do I smell? I mean, it's all the senses. Um, but sometimes nurses find it hard to be in this position, and not necessarily when it comes to testifying for the prosecution,
Hmm.
right? But sometimes they find it hard to fulfill this role for the defense. And I think that there's some thoughts out there that they're helping like a suspect get off, or
Yeah.
you know what I mean? Like they're in, for me, like I mentioned before, it's totally non-biased. So if the prosecution hires me, I'm going to tell them the same thing that I would tell the defense. Like I'm
Hmm.
not creating scenarios that make the defense's case look better.
Yeah.
It's just looking at the facts and just stating what the facts are. And
Hmm.
sometimes, clearly giving the defense explanation of what happened, they may decide then that this isn't a good case I want to go forward with. So I mean, then sometimes that happens too.
Hmm. But the most important part is that you're giving a unbiased, but essentially you emotionless determination. But you can't have emotion when you're doing that. You can only be guided by the evidence that's in front of you, and that's it.
Yes, and think of myself as an educator
Yeah.
because that's what I'm doing, educating, anyone who will listen about medical, and, just making it like just so clear and simple so that everyone can understand.
Got it. When it comes to these abuses and your 22 years, 18 years of experience, right?
Yeah.
Your whole trajectory, right? Is these unfortunate events, is it very common than most common than what people would think they are?
You mean sexual assault?
Yeah.
Yes. Yeah. So, I mean, I think that a lot of victims don't come forward. And just to speak a little bit in the military, and I, I saw military members who were recently assaulted. Now, we did our exam up to 7 days, which is a very long time. Most, I think, the states up to 5 days is what they do. So
Mhm.
we gave them a 7 day window, and they could come in and get an exam, and we would collect a kit. Anything beyond that, unless there were special circumstances and it was really close to that 7 days, we wouldn't collect evidence. But they could still come in and see me, and I could still evaluate them medically, treat them if they needed treatment. Sometimes they had, pain that still was occurring. Um, but a lot of them might come and see me, but not report. And there's a real, I mean, I guess in the military, you can be called out. These a lot of times, and it wasn't just women, there was men too. Like if they made themselves known about this, that their career basically they felt like would be lost. And a lot of times they knew their path. Like I'm doing 20 years, and when this sudden event happened and like disrupts their life, they just didn't know where else to go. Like they could only see this path that they've been on. And, I would sit and say to them, maybe this isn't your path, maybe you gotta, pull off to the right here and go down this path. But that was a real fear. And I think even out here in the community, not even the military, I think it's not reported very often. Um,
Yeah.
Less than it should be. Yes.
Wow. That's unfortunate.
Yes.
Is there like in your experience, like is there anything like is because they were drinking, or like you said, or just like you said earlier, and where like the person you least expected is one committing these acts.
Yeah, drinking can be involved in a lot of cases, or drugs even, we've we can have people that have, we've all heard of roofies, right?
Yeah.
Or ecstasy. So, in order to find those drugs, we have to see that person like fairly quickly, like within the first 24 hours, because that is metabolized very quickly out of the body. But alcohol, it's free. It's not free, but I mean, it's legal,
Yeah.
right? And most certainly, a lot of times we will see where alcohol was involved. And I say that because a case sticks in my mind very much so, where, in the military, they have battle buddies, right? You know, I'm a female, I might be in a mostly male unit, but this guy next to me, he's my battle buddy. And if we go to war,
Yeah.
he's the one that's going to protect my back. And so they feel vulnerable enough to be able to drink around these battle buddies. Like if they're going to protect me at war, like, and then what happens is they take advantage. And so then they feel like they can't trust anybody. This person that they trusted, to drink with, to have a good time with, violated them.
Mm.
So that's pretty intense.
Yeah.
Emotionally,
Yeah. Yeah. Ma- ma-
mentally.
Makes it even worse because you're in the military. You're about to go to war. Things shit hits the fan. You're double traumatized.
Yeah.
And especially if you don't get the help, you go to war, you come back, you're worse than before.
Yep. And they feel like sometimes when they go for help, it's just another stigma that is against them. It's not, I mean, I've never been in a line unit. I can't really explain, that part of it, but, we still encourage them to get help. And sometimes they have very supportive units that really, you know, kind of surround that soldier and take care of them. But sometimes it's not always the case. And, you know,
Wow.
and then we're looking at suicide, you know? Like if it gets so bad where someone just feels like they can't live anymore. Yeah, it's a vicious cycle. Not good.
No. Well, I'm sure I'm happy that you left that place. You're starting your own business, right? You're exceeding at it, and you can determine what cases you feel like you want to take. You have that independence,
Yeah.
and that choice because working and being in that environment, it's as they come. You can't be picky, and that can be after a certain time that can be difficult to go through.
Yeah. Yeah. Absolutely.
So what now? You started your business. You're out there. You're promoting it. What's next for you?
Well, I'm hoping to get a good referral base, which will be nice. And I think that I'm trying to get back into the military too. Like I
As an
have
independent contractor? Yeah.
Yeah, so I have a lot of connections of the people that I met, were great. The thing with the military is every couple of years they usually go to a different job. So, there's always new and upcoming. So it's always, constantly promoting and getting your name out there. But yeah, I think that if I have a nice referral base and work for several people, then it'll be a no-brainer that people will refer me to help them with their cases. But yeah, it's just getting my name out there, I guess.
Yeah.
Right now. Yeah.
Yeah. Yeah. I mean, you already have the experience. You well connected. I don't think I'll see any problems. I think, sometimes, and even better, sometimes they'll need that outside opinion, because when you're under one branch, right? And everything, like when you're under one branch, let's face it, and it doesn't matter what type of business, everything could get misconstrued. You said Red Sox, you pass the chain of command, they'll end up saying Purple Sox or something like that. You know?
Yeah.
Like everyone has their own way of doing things, but as an independent, you're more free to give a more adequate information than, you know, waiting for others.
Yeah, it's also making me much more well-rounded. So I have, testified in California and Alaska and Idaho and Virginia. So, it's learning about all these other states as well. So I'm not
Wow,
exclusive to
yes.
New York, but, everybody's just a little bit different. And, we did talk about like the standards, the protocols. So we do have what is called national standards and protocols. But really, what's these forensic nurse, what do I want, programs, right?
Hmm.
Forensic nurse programs, they really are based under their own standard operating procedures. So they'll use those national protocols as guidance, but what they have to do is write their own policies and procedures. And that's where we need to look and see, did they follow their own policy and procedure? And, if they didn't, that's where we can look into, getting them
Yeah.
for not for not following their protocols. So,
Oh wow. So you're
yeah,
like you're not just like studying what's in front of you, you're also studying their policies. Like it's like an audit. It's like getting an audit by the IRS, basically, right?
yeah, kind of. I mean, we do have a lot of forensic programs across the United States that are doing great, great things. I mean, I saw of a place, I don't know if it's Connecticut or, they have a bus that they actually will go out and they will meet the victim and do these exams. Great things are happening, and there's a lot of great people out there that are like, investing their time in, the research and the things that we need, because you would think about, it's hard in our specialty to get a lot of evidence-based practice from research, because who's going to volunteer to be sexually assaulted and who's going to volunteer to be strangled? Those aren't
Mhm. Yeah, yeah,
that easily, we can base research off. So all of our pools of research come from very small groups, or programs that are trying to, get that information for us, so that when we do go to court, we're putting out the right information in these trials.
that's amazing. That's amazing. Only someone where your expertise could do that. Like it's I I find it like if you don't if you don't like look for it or find somebody doing it and embark in that sense of curiosity, you will not know about this information.
Yeah,
You
you're
know,
right.
it's like if you it's like when my son, I have a 7-year-old son, he's autistic, right? When I first found out what autism is, right?
Mhm.
And it's not something that like it wasn't like here's a pamphlet you can learn about it, right? It's something that
Ah,
yeah, he's autistic. Okay, what does this mean? And it was because me and my wife went out and we had to look for this information. You know, autism has been around for years, and
mhm.
yet the information is so limited, right?
Yeah,
And given your scenario, if the person hasn't gone through it, they wouldn't know about it.
yeah. And that's sometimes too why people don't come forward, and just getting that information out there. And people, sane nurses aren't available everywhere, and
Mhm.
that's the other hard part. I mean, we are a very small group. I don't can tell you right now. I mean, there's hundreds of certified sanes, but I mean, we're talking across nationally.
Mhm.
You know what I mean? And I might be wrong. They might be in the thousands, but it's not a huge number. And a lot of our experienced saints are, some of them are the older population who will be retiring. You know what I
Yeah.
mean? So we need to keep offering this service for
Yeah.
patients, for sure.
No, yeah, I agree. In the world and where social media, everybody wants to be an influencer, right? We need more medical stability, assistance, uh, more people to care and share the word. It's very
Yeah.
important.
Yep, absolutely. I'm glad you agree.
Yeah, well, many years ago, I graduated and got my diploma as a paramedic.
Oh,
So I did the schooling, did the practice, went on, did the practice, which if I would have known back then, I'll probably just end up being a nurse because I enjoyed more the hospital than the ambulance. Like
uh-huh.
when I lived in Puerto Rico, so the potholes over there is like crazy. So like I imagine you're trying to and how do you put it? Get a vein, right? Do
Oh, start an IV?
right, and a pothole hits, and another one hits.
Oh,
I got pretty good at it, I'll say, but uh, in the hospital was everything was moving, like everything was so life is happening, and you're always on the go, boom, 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 boom. An ambulance, we had to sit there and wait, and most of the time we would get a lot of elder people
mm-hmm.
that didn't have the assistance, didn't meet the requirements, lived alone. Um, and yeah, but yes, very, very important.
Yeah. They see a lot. Paramedics, ambulance crew, yeah, they see a lot.
Yes, yes,
Yeah.
yeah. I remember the first time somebody had passed away, and we were giving CPR inside as the ambulance was rolling. We were giving CPR, break through the doors, continue CPR, but it was too late,
Yeah.
you know. And that's me just practicing, not even getting paid for it, right?
Yeah.
So it was incredible, but I do agree that we need more, and it's difficult. I feel like sometimes this world's going to shit, but that's a different story. But yeah. So where can where can the people find you? Like social media, website, card, how can they contact you for your services?
Yeah, so I am on LinkedIn, Rachel Countryman, and my business is Countryman Consulting. And so my website is countrymanconsultingservices.com. And if you go to my website, yeah, it talks about my services. My phone number's there. I have a contact me sheet. Like if you would like to schedule a call, we can discuss a case for free. I don't charge for that. Um, or, if you are ready to hire me, there's a form you can fill out that will give me the information and then I will contact you.
Oh, there you have, ladies and gentlemen. Go check her out. Go check out her website if you need to contact her. And feel free to ask a question. She's there to help you. Rachel, thank you for joining me. It's been an
Thank
honor,
you for
pleasure
having
talking
me
to
on. Pleasure with you too.
you. Make sure to go follow me at DIOTALK TV. Go like and subscribe our YouTube channel, DIOTALK TV. Follow me on Facebook, Joe Mark King Diaz, on Instagram, Mr. Inspire 10. I'm out, guys. Have a good night.